Hi everyone. It's easy to say that if your bird needs medical attention, she needs to see an avian vet immediately. But things aren't always so simple, and we understand that. You may not be able to get there until the morning, you may not have a vet comfortable with birds in the area, or perhaps it's just not practically going to be a possibility for you. So this video is to go over what you can do to support your hen at home while you're waiting for help to become available. Now, I need to be really clear that this is not about treating the disease, it is about emergency first aid. Birds will usually not show behavioural signs of disease until illness is already quite progressed. They are the epitome of a prey species. At the risk of being picked off by a predator, they will deny and pretend it's all fine until it's really not. So often by the time you've noticed something's wrong, she's already critical and needs emergency care to survive. Usually by the time they're in end-stage disease, they have dangerously low blood sugar, low blood protein, they're dehydrated, they're suffering from hypothermia. And in fact, this is why we see the critically ill bird fluffed up, because they are trying to conserve their energy and maintain their body heat. If you can, pop the bird in a closed, dark box, empty the food and water, leave the kids and the dogs at home, turn off the radio in the car and get her to the vet quickly and quietly. If she's already at the state where her comb is changing colour, a bluey purple colour, if she is wide open mouth breathing and struggling for air, if she cannot stand, or if her eyes are mostly closed, this is not going to be an appropriate approach for you. In these cases, she is suffering significantly, and if you cannot get her to a vet for emergency treatment, she needs to be humanely euthanized to be put out of her suffering. And we have got another video for you on how to do that humanely yourself at home, so jump over and check that out if that sounds like you. However, if you've perhaps just started noticing her behavior changes, maybe she's slowed down, she's sitting by herself, is maybe a little fluffed up and going off her food, then there are some things that you can do at home to help keep her comfortable overnight while you're waiting for help or for treatment to set in. The first thing we need to address is keeping the environment warm and humid. Chooks are small animals and they lose their body heat very easily when their body is struggling. In doing so, they lose moisture to the dry air as well. So we want to keep them in a warm environment at ideally about 28 to 32 degrees Celsius. If you've got an incubator for some reason, that's amazing. Otherwise, home jobs could be the hot water cupboard or even a polystyrene box with a hot water bottle, with a towel against the water bottle, protecting her from burning herself, of course. The tricky part is making sure the temperature's not fluctuating all over the place, so grab yourself a rectal thermometer from a pharmacy or drugstore and monitor her temperature just using the cloaca. We want her body temperature to be staying between 40.5 and 41.6 degrees Celsius. In chicks, please don't try and take their temperature. Grab yourself an environmental thermometer and keep a close eye on them. A critically ill bird is usually losing heat. However, of course, you need to monitor them closely for any signs of overheating, which is open mouth breathing and opened up feathers holding those wings away from the body. The second is correcting her dehydration. It's going to be tricky for you at home to try and estimate how dehydrated she is. This is something a vet can do for you. But as a rule of thumb, a 2 kg chook should be needing about 6 ml per hour just to maintain herself. But we're going to assume that she's already probably quite dehydrated. Any more than a mild dehydration, she will need a vet to survive. So let's assume that she's only mild to moderate. Now her crop can easily hold 30 to 50 ml. So your bird vet will be able to give this in large amounts using a crop tube. All right, but that's not something that we're going to be teaching here today. That is a veterinary procedure. Now, as we've said, if she is severely or even moderately dehydrated, she's going to be flat, she'll be lying down, she won't stand. Oral fluids are not going to cut it. She needs to either see a vet and have shock fluids straight into the vein or bone. So if she's already in this state and a vet is not an option, that's going to be a euthanasia at home. But if she is still standing, if she's still pooing, her crop is emptying, then we know the gastrointestinal tract is working well. So you can offer her fluids. If she'll drink on her own, that's amazing. Otherwise, you can syringe fluids very slowly and in very small amounts into the beak. Syringing into the beak is slow and arduous. It can be stressful for her with the added element of handling. So check out our video on how to give oral fluid medication to see how to do that safely. But if she'll drink it, that's absolutely ideal. If she's really cold and in shock, we need to get her warm first before giving those oral fluids. Otherwise the fluids aren't going to absorb very well. These are our priorities. Now, fluids are a complex topic in themselves, and at your vet clinic, they will differ depending on the patient, the condition they're suffering with, and the severity of the condition. But at home, you're going to be a bit limited here. In many cases, our standard oral fluids with dextrose, which is a sugar source, is going to be beneficial. The common formula made for human babies is a really helpful go-to. Warm it to the temperature of a baby's bottle. That's a nice, quick and easy way to get your chook to warm up a little bit, like a hot cup of cocoa. Our third priority is feeding high protein, energy-rich food. No one can survive on sugar water, right? So if she perks up and responds to rehydration, you'll need to start offering her a good diet. I recommend using a critical care mix, or in absence of that, you can use a neonate hand-wearing formula that you can usually pick up either from a vet clinic or from a pet store. You're going to add water to it to make it a mash. If she'll eat it herself, that's great. Or you can add a little more water to make it into a slurry and syringe her. If she's eating on her own, I will often suggest to have some cat food on offer as well. It's very high in protein for those critical care patients. We also want to make sure that she's got on offer whatever she's used to eating. These are creatures of habit, and sometimes all she wants to eat is what she's used to. We need something into her, so if that's all she'll take, that's what she gets. But certainly, critical care diet, baby hand-wearing mash is ideal, high nutrition, calorie dense, and often has healthy probiotics in there as well. Now, I need to mention here, if you are confident tube feeding, that's a skill you possess, then go for it. I'm not going to teach how to crop tube on here today. That's generally something your vet will do for you. There is only so much you can do at home to give her a nudge in the right direction. Right, number 4, we're going to weigh her daily. So assuming all is going well, this is a great way to monitor her progress at home. Weigh her daily on tiny wee kitchen scales. Weigh a towel, then burrito her nice and snug, and weigh it again. Subtract the weight of the towel and you have her weight. Just to reiterate here, the underlying issue that caused her illness in the first place needs to be addressed, okay? And that's a whole other issue. You will need to touch base with an avian vet if you don't possess that knowledge yourself. Don't muck around. Treatment should be initiated as soon as possible. Jump over to our video on performing a physical exam on your hen. That might help point you in the right direction. Now, I also just want to note before heading off that we can push a really sick bird over the edge with handling. If she is open mouth breathing, she may need oxygen supplementation. Don't go trying to shove fluids down her throat. If she's open mouth breathing, she's just as likely to end up breathing it into the lungs. If she's weak and begins gasping and trembling, put her in a warm, humid cage and let her calm down. There are many birds that will need aggressive treatment, so this in no way replaces a vet visit or personal advice given by a vet that has seen your animals.